With manualtherapist.com, edgemobilitysystem.com. So I just want to show you a demonstration of a new way I came up to use some compression wraps or the edge mobility bands. So out here is some limitation in median nerve mobility. And I have not done this yet other than a test. So a little shoulder depression, abduction, full external rotation, full elbow extension, full supination, making sure I have his thumb and his fingers, not letting his DIPs bend around my hand, and that's all the wrist extension he has. So I'm going to try wrapping the forearm, see if that makes a difference. Because there's not a lot of tissue here, I'm only going to wrap between 25 and 50% compression. I'm going to wrap around the part of the forearm where there's most likely restrictions or potential maybe median nerve entrapment underneath the pronator. But in general, what we're looking for is just to get some skin movement here and stimulate a lot of receptors to give that brain information so it can release the lockdown on this motion. And that's assuming he doesn't have any true joint mobility issues or he's not a slow responder in terms of actual forearm or wrist mobility. Definitely more extension here. How's that feel?
Not bad.
Yeah. So there's definitely more extension. He only had maybe about 5-10 degrees of wrist extension. He has more, so you can definitely keep this on. Some variations. Again, since much of what we do, this is very similar to taping, much of what we do is actually just sensation through the skin movement and skin lifting. In this case, it's compression. So I can actually take his skin as it's compressed, as I'm doing the median nerve glide. I can actually pull in the opposite direction for a little bit more stretch. You feel that?
Mm-hmm.
If I was actually doing supination, I can twist the skin under the band in the opposite direction, or I can kind of combine those techniques for a little bit more stretch, twist in the opposite direction, and also pull. You feel stretch with that?
Yeah.
So then I'm just doing a tissue mobilization and a kind of twist. So let's unwrap. And we will do a post-test. And again, I've used this on several other patients. I've used this on myself. A lot of times, if you have very, very uncomfortable paresthesia, this actually reduces that or almost eliminates it in some cases. Thus, the movement itself, the neurodynamic movement itself, is much more comfortable. And the closer they get to end range, the more likely you are to have lasting improvements in range of motion. So, definitely still much better. You okay?
Mm-hmm.
All right.